Every leader has a strategy. Executing on that strategy is the challenge. If you want to learn how to effectively achieve what you've set out to accomplish, then this show is for you. Gain keen insights and listen in as leaders share their stories and challenges. SOAR Vision Group and the Baldrige Foundation welcome you to Leader Dialogue Radio.
Hi everyone, I'm Duffy Dixon. Welcome to Leader Dialogue, brought to you by SOAR Vision Group and the Baldrige Foundation. Joining me is Jennifer Strahan. She's the Chief Operating Officer of SOAR. Jennifer has partnered with more than 100 health systems and businesses across the U.S. to help them transform their strategic and administrative operations. Lisa Council is the Chief Commercial Officer of SOAR. She has more than 2 decades of clinical, leadership, and clinical informatics experience. She also spent 19 years at the McKesson Corporation. And our special guest again this week is Alan Nalle. Now, Alan is the Chief Strategy Officer at PatientCo. And instead of trying to read what you do, Alan, because last time it was better when you said it. What does PatientCo do?
Oh boy, getting put on the spot already. Here's the elevator pitch. It's a consumer payments company focused exclusively on healthcare. We allow leading health systems to offer a superior patient financial experience, from pre-service to point of service to post-service, billing communication and payment tools that help make healthcare understandable, affordable, and create loyal relationships between the patient and the health systems.
So from womb to tomb of the patient visit, in reference to last week, for those of you who have not listened, go back and listen. We talk about that. So exciting things you've already missed out so far as we've been in the studio just hanging out, waiting to go on air. One of the things we talked a lot about last week was PatientCo and the value that it brings to consumers, to patients, to hospitals and providers who are using that service to be able to bring more upfront visibility and transparency of the patient bill to the patients at the beginning of service as opposed to 2 months after service or whatever the case may be.
Because what we talked about is often you can have a fine experience at the doctor or the hospital, and then those bills come from all sorts of places, numerous bills, different names on there, different amounts, and that can be the lasting experience. Mm-hmm. That can be the last thing you remember. And that cannot be good for doctors and hospitals if you have that negative end.
Yeah, if you think about it, revenue cycle really is the first and the last thing that touches patients. Because in the beginning, you've got your patient access where you're working to schedule those visits, or that might be the first person that when you walk into a doctor's office or a hospital, that can often be the registrar. That is all under revenue cycle. So it is the first thing and the last thing that we experience. And you kind of have the meat of your visit with your provider. And it really is an element that, again, we talked a little bit about last week. It's hard to talk about money with patients, but it's one of the top things on their mind.
Well, and in health systems, there's been a lot of push around patient experience officers and really looking at patient experience, but rarely do they talk about the rev cycle and the impact that it has on the patients and their family.
Right. So one of the things I would love to explore a little bit this time is to dive into this a little bit more from the PatientCo side. So as an organization, you guys are a growing business, obviously, providing a great value to communities, to hospitals nationwide. And your role as a strategy officer, we talked, and you mentioned this a little bit, Lisa, where you almost compared them to an Amazon, being able to, how do you bring that consumer ability, if you will, right there at the forefront. Mm-hmm. So what's next for PatientCo? How do you keep up? How do you keep growing? How do you keep that vision alive?
Well, we talked a little bit last time about some of the complexities associated with the EOB. Remember, this is not a bill. Let's train people to throw away billing communication. And, you know, what that means from, well, geez, I have one healthcare visit. Why does it have to create 5 different bills from facilities to professional to everything else? And it's like, is it just me or are the balances changing? So now I just want to hang on to it and not pay. And so, Jennifer, to answer your question very directly, the only person who has a full view of the billing dysfunction in healthcare is the patient. So we have to take the patient's perspective and how we think about solving that. And so that means, you know, actually trying to tackle with better technology, you know, an EOB experience that might actually be understandable and is like helpful and usable to the patient. So the consolidated bill, bringing more payment options up front with those estimators that we already integrate with to accept payments. But for instance, how do you a lot of that estimation process is largely driven by the revenue cycle teams. That's a people-intensive effort. In fact, we were chatting with a client, and they said, Alan, after we run an estimate, we start what we call the chase. And I said, the chase? And they said, yes, the chase is where we try and find them. We chase after them. In other words, who answers a telephone call from an unknown number? I mean,
Nobody.
Oh my gosh, is it just me or does my mobile phone feel like a spam creator these days?
It is.
I'm like, man, this thing's sponsored by Hormel.
And I swear the do not call list does not work.
That's why all those states have now banded together to create new legislation. Did y'all see those articles just a couple of weeks ago around new legislation around spamming for mobile phones? And so it's like everybody knows this is a problem. People don't pick up, and so our poor clients are having to start the chase to try and communicate the estimator. Well, PatientCo already has a tremendous amount of digital communication tools. So if we're sending an e-bill, Duffy, why can't we send an e-estimate?
That
Absolutely.
would be great.
And so those are the items that we're bringing to market, launching, and refining. We already customize our e-bills. So for some people, we talk about, hey, this is such a convenient and fast payment experience. This is all about ease. For others, based on maybe bill balance or other data, we might lead with affordable payment options. Affordability is the number one consumer concern relative to their healthcare billing. That's what they tell us when we survey them. And so if we're tailoring the e-bills, what's wrong with us tailoring and personalizing the e-estimate? And so if it's an estimate where you have a really good confidence that this is the dollar amount, like an MRI, we can go ahead and enroll somebody in a payment plan or a pay in full and be really confident that that's the number. In other cases, there may be more clinical variability where the estimates were not so sure. Well, can you take an initial payment and start creating commitment to pay, because behavioral economics tells us that commitment to pay is really, really important. And so how do you help do that while giving the consumer more confidence that at least they have some idea of what the dollars are?
And I would imagine the statistics show that, again, that commitment to pay is a really big psychological component where patients do actually want to pay. They don't know how much to pay. I don't want to overpay. And as Duffy mentioned last week, we were talking about, am I going to get a credit at my health system?
Yeah, nobody wants a credit from the hospital. I don't want to go back there. I don't want you holding my $60 until I return.
Right, but you know that people have rendered care for you and or your family, and so you there's an emotional attachment around, hey, I want to contribute to what is due, but I don't really know how much is due. So I applaud that e-estimator and really being able to get something on the forefront for consumers to engage with.
You got it. So that consolidated bill, taking many bills, making it into one, we're doing that for more and more health systems today, creating a really wonderful branded experience. And that branded experience is an extension of the health system's brand. So to Duffy's comment, that last touch is a good touch. It actually leaves a better taste in the mouth, kind of proverbially, than that bad touch would. And we're delivering that and actually creating more digital users. So just recently we launched a digital first bill product. We're actually extracting contact information from the HIS system. Some of our clients, instead of sending a paper statement, they're actually sending an e-bill to 80% of their patients the first time before they've even opted into paperless communication. So e-estimates, consolidated, branded, and we're creating more digital users because we know that digital and self-service creates a better customer experience.
So you tackled two things, and you alluded to it because you mentioned you survey your patients. And so in the midst of that, there were two things that you mentioned, and I was thinking about this. I was actually going to ask both Lisa and Duffy this, and then I was going to ask if you guys request the same thing from your patients, and that was, what do you look for in a bill? As a patient, what do you think about with that financial aspect?
Well, I first want to see what I'm paying for. Usually they just have a date of service and then an
high
amount. and again, because you're getting a bill from the for the anesthesia, and you're getting a bill for the lab work, and you're getting a bill from the physician, and you're getting a bill from if they're under a hospital system or whatever else. So it would be neat as and I think last week Alan said it too. Instead of what is the word for getting your blood drawn?
Venipuncture.
Yeah.
Yeah, what's a venipuncture?
You could just say, remember when we drew your blood? But it would be nice as a breakdown. We ask for it everywhere else. We ask for it at a restaurant so that we can check what we paid for each item. We ask it for everything else. Could that not be done?
Yes.
For sure.
Could be.
Yeah, line item detail. That's what that is called.
But what's interesting about it is it comes to mind for me. So I was thinking about this even myself. And the two things, and you alluded to this, Alan, one would be affordability, right? Why do we have to go in and buy a car every time you go to a hospital or something? I mean, that's insane. And then two is simplicity and ease. And those are the two things that I think about when I'm a consumer, or if I have to bring my son into the doctor, or whatever the case is. I want those things. And I don't think that's too much to ask, is it?
I would add one
crazy.
thing to that, and that's
Yeah.
transparency.
Yes.
Right? Because I believe that as markets are becoming more competitive, as the Amazons of the world and Googles of the world are coming into healthcare, again, it's going to put demands on health systems to kind of provide transparency that we've never provided, like a line item detail bill. So consumers are going to shop their health care. And we're seeing it. It's going to make a much bigger impact, and organizations are going to have to be ready. And I think companies like PatientCo are teed up to really be able to handle that in the future.
I've been saying for years, it's insane we don't have an Expedia of healthcare, right?
Yeah.
That you can easily go in, shop around, and see everything with quality, price, the satisfaction or experience scores. It doesn't seem like it should be that complicated.
Yep.
But
So-
yet it is.
Yeah, and so given
Yeah, it
all
is.
of that, the next big question for Alan, though, is as you're doing this and as you're a growing company, what are the challenges? Because you are going into healthcare systems who think they're doing it right or what are your challenges?
This is probably not unique to PatientCo or to the listeners today, kind of from their home. And it's culture change. It's change management. We're asking organizations, in many cases, to pull out old, tired legacy technology. It creates new data. It creates a new way of reporting. We're asking them to rely less on those team members in the call centers to take calls, and we're shifting the payment experience to more self-service. Many of our clients, 80% of the dollars are done through patient self-service. When we ask them, we actually give every person who makes a payment, we give them the opportunity to give us a happy face or a sad face.
Yeah.
You know that we get 95% happy face after people pay their bill?
What?
Wow.
Yeah,
People are
95%.
happy to give away money. Yikes.
That's right. We also did a little experiment.
I'm going to try that personally.
Yeah.
Just donate and give me a happy face.
We actually did a little bit of an experiment on Net Promoter Score. So we asked our patients for some of our clients, after this billing and payment experience, are you more likely to recommend the hospital to family and friends? And did you know that our hospital clients were getting Net Promoter Scores north of 50 and 60?
Wow.
And so that 50 and 60, compare that to the industry average for hospitals, which is closer to 16. That's wow. Okay.
I know some Net Promoter Scores.
Yep, that's right. And so, it really is an experience that matters, and we're just happy to be part of that program. But it's still change management, because we're asking people, we have to go through IT and health systems just like everybody else. Like, getting prioritized in the IT department, is that easy or hard?
Hard. It's hard.
Oh my gosh. And it's like, I really feel for the CIO and their organization.
Yes.
I mean, think about how many projects that people come to them with. And so even though implementing us, we integrate into Epic, Cerner, Meditechs of the world in order to automate all of the payment posting and reconciliation. That's a great administrative spend, but sometimes the CIO's office hears that and they're like, oh my gosh, integrate into our EMR.
I don't have time. You're at the bottom of my list.
That's right. And so even though it only takes just a handful of hours from their team, because we reuse all of our certified integrations, like we're in Epic's App Orchard. We have certified integrations. Even though it takes very little time, it's still that change management and talking to people about, security and where their data is going and all of those things. So it's helping them understand, well, we're a SOC 2 shop, we're secure, and talking about, we're certified by Epic for these integrations. And so it's that change management piece, and also a bit of, kind of just the impact on the staff.
So just to kind of take that back for listeners, as a reminder, you can go to leaderdialogue.com. And you can see our organizational hierarchy of needs, in which one of the things around strategy deployment is being able to provide focus. And a lot of times you brought up a really good point that I think we don't give enough credit to our CIOs and our IT teams who are stuck implementing the dozens or even hundreds of initiatives across large organizations, because it's like, oh, it's only one or two things for me, but then it's one or two things for 50 other people or hundreds of even more other people. And they literally just get where we have maybe a focus from a strategic level on our high priorities, which can encompass so many initiatives and objectives underneath it. And so just again, I think it's important to recognize that as a company, we have to also think about, hey, what are our true priorities? Which means even from IT or from a strategic standpoint, being able to say no to certain things, which can be difficult for any company of any size.
Yep, for sure. That was the say no part really leads us into the do less than obsess. We talk about great at work.
That's good.
That book is amazing, but we as leaders and those of us who are helping leaders, we really need to get in and talk about their strategy, talk about what their goals and objectives are, and then help them devise a plan where they can actually focus and not be so distracted. Those CIOs, you are spot on. They are being bombarded with requests across the health system. And someone at the strategic level needs to be able to say, you know what, these 3 or 4 initiatives are your priority, not everything else. But that's very hard message to deliver.
It is. It is. The other thought that I was thinking about as you were talking earlier around, as we take this back to the patient's perspective, there's an element behind at what point does this become something that's important to our patients, and at the same time, what's important to our patients becomes important to us as a strategy. And if you think about a 2x2 grid on payments, obviously, so that's part of obviously the mission of what you guys are doing. There's this balance around willingness and then ability to act, right? So willingness to pay and ability to pay. You can also relate that same grid to strategy, right? What are the things that we're working towards with our strategy that we want to pursue, and then the things we're actually capable of doing. And these things with CIOs, and it's not just with information technology, it's with anything that we have capacity restraints on in operations. That's where you often create, honestly, that tug sometimes between whether it's operations and strategy, operations and marketing, or sales. We were talking a little bit about this before, kind of offline, where there's always, and any business has this, where it's how do we have a desire to do something and then the capability to deliver on it, and not just deliver on it, but deliver on it really well.
Yeah, well said. Well said. Increasingly, we find that the CIO organization is a great organization to partner with. But to your point on the prioritization, you have to be very crisp and clear around what you're asking from that organization. And also, we found that reference calls with other members of other CIOs of teams from other kind of similar health systems has been tremendously helpful, because then they don't have to listen to us and believe us; they can listen to their peers.
So that's someone who's already been through it.
Absolutely.
So you're a leader in your organization. I would imagine you have a very similar approach with your team. Can you tell us a little bit about the culture of PatientCo?
Oh, wow. We love talking about that at PatientCo. You can check out PatientCo. You can check out PatientCo Life. We really spend a lot of time thinking about the culture that we're creating for ourselves and our colleagues. And we call ourselves PatientCoians. That really
Do you have a t-shirt for that?
That really rolls off the tongue. Oh God, I have got to get that swag ordered. Swag is coming.
Yeah, just so you, for people who didn't listen last week, you have to, because at the top we will explain what Alan was wearing and why we all want one. That's all we're gonna say. That's why you have to go listen to the other podcast. That's right. You're dying now, aren't you?
What were you talking about at that minute?
So
the PatientCoians, our PatientCoian culture. Hats off to our CEO Bird Blitch. He founded the company after a great clinical experience, the birth of his daughter, but a terrible billing experience following the birth of his daughter. And he has been instrumental in focusing on our culture. We survey our employees every single year to understand what's working and what's not working. We have focus groups to talk about that. We have a culture committee where the culture committee helps inform, kind of describing initiatives to help with our culture. And so we do things like we try days where we don't have meetings in the mornings. That way we all get some heads down time, this notion of like maker time versus meeting time.
Perfect.
And so we do things around productivity. We have sessions around work-life balance and how to manage that, because in a fast-growing company, I'd like to say it's always 9 to 5, but it's not always 9 to 5. And so but we talk about that because we need a balance for our people. And we just do a tremendous amount of work in trying to ensure that we're creating the kind of positive culture where people want to stay there and want to grow and build a career there. And we do that just because we want to have the best people. And I think if you're all welcome to come take a tour at the office. And I think when you meet folks, you'd agree we have a really special place.
That's awesome.
And the hierarchy of needs, which is on leaderdialogue.com, we all talk about this. At the top are leaders. We talk a lot about good leaders, leadership, and that sort of thing. But at the bottom is colleague. It has to get to the front lines, and colleague engagement, and making sure the people who work for you buy into what you're trying to do, and they understand what the strategy is, so they can say, what am I do? How
am I
is,
contributing?
Right. How
Right.
is what I'm doing contributing? Yeah.
And just to reframe that in terms of a top or a bottom, it's really around a foundation,
Okay.
right? Your colleagues are the foundation of any organization.
So I shouldn't say down.
So,
Yeah.
right.
The bottom.
Or if you think about servant leadership, right? It even has where you invert a
It's upside
pyramid
down.
to where
Invert it,
leaders
yeah.
are on
Yes.
bottom, and they're serving their not only their customers but also their actual employees. And I think that's something that when any size business, especially as you're growing a company, where culture, and especially in today's world, right? Everyone kind of thinks about the Google culture and that kind of, if you have to work and we invest as many hours as we do in our companies, why not like where we work and the people we work with, right?
Yes.
There's no harm in being able to say, hey, that's not our culture. It's not a good fit. But when they are that foundation, if you treat your people well, they will treat your business well. They will treat your customers well.
And it sounds like that's what you're experiencing at PatientCo.
It is indeed. We have great teammates. Duffy, to your comment, I love you linking, kind of people understanding the strategy to executing the strategy. So I'll just share a story. In a previous year, one of our questions was, I understand the decisions that the business is making. And we actually saw a decline that year. So the culture committee chose to tackle that, and their recommendation was spend more time in the all hands talking about the strategy and talking about what you're seeing in the market. Because, Duffy, Jennifer, your points are spot on. People need to understand the North Star that they're pointed to and just how their day-to-day kind of business and work is helping to support the entire organization's journey. And so, what we realized through that survey is we weren't doing as good of a job as we could have articulating that for the organization. So, for instance, we've actually revisited what we used to call Town Hall. We now call PatientCo Live. It's actually like an Ellen DeGeneres style talk show
Oh, that sounds
where
awesome.
we literally feature people in little segment vignettes. We beam it to anyone who's virtual in our employee base, and we talk about company performance, recent initiatives. We have reports from the field, and we also do things to make it fun. Like our CTO recently bobbed for apples against our recruiter. Everybody's face got super wet. People were cheering
That's
and yelling,
hysterical.
and it was awesome. And we bring in a new host every time, so people are rotating the hosts, and the hosts are starting a really friendly competition around who gets the most laughs. And
That's
it is so
hysterical.
cool to watch.
Do you get a laugh-o-meter?
Yeah, we have not made that technology yet, but we'll get right on it.
Yeah, put it on the list for the IT people. I'm sure they'll be here. I'm sure, just give them one more thing
Yeah.
to do. Just one
That's
little
right.
thing.
Just one more thing. They still have a couple of hours where they're
Yeah, a
sleeping.
couple of hours.
And Jennifer, what do you remember the statistic that we said, I think, on our very first show that just blew my mind? Give it to Alan.
You're talking about the fact that 95% of most people in organizations do not understand how their role connects to strategy. 95%. Yep.
Yeah.
Which is why SOAR does what we do. We really
Right.
help people connect strategy and to the people and their mission.
And that is so important. I've literally had colleagues say, Alan, describing this allows me to make those little tiny trade-off decisions in my jobs in a much more effective way. And so from an R&D or development and engineering, by just having kind of a strategy component around, we need to be more convenient. That allows for them to make some subtle trade-offs that, and once again, if you can align everybody and we're all rowing in the same direction, like you're really harnessing the power of an entire organization. It doesn't happen by accident. You really have to work at it.
And those frontline resources, they want to be involved.
Mm-hmm.
They really don't want to be just passive employees by and
Right.
large. They really do want to be contributing to the mission of your overall organization.
Engaged.
So that's exactly right. So colleague engagement is so paramount.
And it's really one of the things that you just mentioned. So 2 thoughts come to mind. One is that you said a really important word, which is trade-off, which means we have to empower our team members to be able to say no, or to be able to have that open communication with their leaders to be able to say, hey, if we're adding this, what's coming off, right? So that there's that balance. But the other thing you talk about is it goes back to our hierarchy around engaging our team members as owners, right? So that they understand not only how they connect to the organization, but how their job function connects. There's an analogy. It's not a book, but it's an analogy where
We
if
got
you
our
think
book
about
reference yet?
Yeah, we did. Great at work.
We did.
Great
Yeah,
at
yeah,
work.
it came
Yep.
from
Okay,
Lisa.
good.
Thank you,
I'm
Lisa.
glad we checked that box.
Check that off.
Okay, good.
But if you think about it's an analogy when you're walking down the street, you see somebody who's laying bricks and you say, hey, what are you doing? And they say, oh, I'm laying bricks. And you go, great. And you keep going down the street and you see someone else laying bricks and they doing the exact same thing. And you say, hey, what are you doing? They say, oh, I'm building a wall. And then you walk down the street and you see one more person who's laying bricks and you ask, hey, what are you doing? He says, oh, I'm building a cathedral. There's a difference when you're connected to the vision and the strategy. They're all laying bricks, right?
Mm-hmm.
And so when you think about a company like PatientCo, or even in hospitals where they're doing revenue cycle, well, I'm working on a patient's bills, not that exciting. Or if I'm cleaning a patient's room, but if you say, well, no, I'm helping them understand where what the financial impact to them is on a personal level, or I'm helping prevent infection. You're not just doing a task, you're really building that into the higher strategy.
And meaning.
Right.
You're helping to create meaning for it. And I love that story with the cathedral. I'm going to steal that. That's
Good.
really good.
It wasn't mine, so steal away.
Okay. Well, I will leverage freely. How about that?
But that goes back to what you said, that we want, if we're so concerned about patient experience when they walk in the door, that they're not waiting around, that they get seen in a timely manner, and then we follow up with their care so they aren't just sent home and there is no follow-up. The billing, I mean, you've got to make that more appealing. And you said, I think everyone does want to pay their bill. Like if I get that late, we talked about, you get the thing, we're going to turn you over to collections.
Right.
And I feel horrible. It's like, I didn't get another bill. Where did I
Right,
miss the bill?
confused.
right.
Yeah.
Confusion.
I do think,
Absolutely.
I'm sorry.
Again, I'm a nurse by background, so I believe that just inherently people really do want they want good health care, they want good quality outcomes, but they also want to contribute where they need to contribute and pay, but they don't want it to be so difficult to have to navigate those waters.
Right.
And at the same time, I think there's this angst around, well, I'm going to trust in my insurance company to do their part because I'm paying those premiums. And at the same time, I'm feeling guilty because my provider's not getting paid. It is a really bad psychological place for our patients to be in. So, again, I applaud PatientCo for what you guys are doing.
You bet. Well, it's a bad operational place, too. We survey health systems as well as patients. You know that confusion about the bill, health systems agree, that's one of the number one sources of calls. And so that's also a number one source of cost. And it doesn't exactly put you on the front foot of having a great consumer experience because they start off being confused. And so, all of those kind of technology pieces that we bring to help make it more understandable, easier to deliver, digitally communicated on mobile devices, that's all part of just making, kind of reducing those phone calls and, creating a better experience.
There used to be an old adage that at least I would hear my leaders talk about. It's like, what's the number one thing you're sure about from a healthcare visit? And people are kind of all looking around at each other like, okay, is it my length of stay? Is it my outcome quality? Well, then it's the bill. Well, then they all look at each other and go, well, there's no agreement on the bill, right? I'm going to get some sort of bill, but is it accurate?
Yeah.
Is it really including everything? Am I providing transparency? It's not even that. So kind of a bad place to be for health systems.
Yeah.
Well, the leading ones are fixing it as we speak.
That's awesome.
And so the good news is that there is an effort to continue to drive towards consumerism, which we've talked a lot about. How do we, again, make things affordable? How do we bring ease and transparency to the market, to the people who are needing this? So, again, a really great show. Alan, thanks so much for joining us as we've talked through a broad spectrum. We kind of bounced around a good bit today. We started talking about, obviously, PatientCo, the value you guys bring, what's next on your radar as you continue to deliver value to your customers and your patients. We also talked about really the alignment between strategy and culture and operations and how those three things fit together. And there's an underpinning there where your structure of your organization also has to support that and have sources of empowerment, sources of ownership for your staff and your colleagues and your team, because they really are that foundational element of any organization. And at the end of the day, it has to connect to purpose. It has to be meaningful so that people can make that connection.
Thanks so much again, Alan. We appreciate it. And also thank you to our listeners for joining us on Leader Dialogue, brought to you by SOAR Vision Group and the Baldrige Foundation. Remember, you can listen to a new live show every Friday, 1 o'clock Eastern Time. Now, we have those shows, the live one, obviously, if you can't get to that, we keep all of our shows on businessradiox.com. It's the Gwinnett Studio, and then select our show, Leader Dialogue. You can also visit leaderdialogue.com/podcast. On behalf of Jennifer and Lisa, and thank you for joining us again, Alan, I'm Duffy Dixon. We'll see you next time on Business Radio X.